Good morning, everyone. Great to see all of you back here today. I'm going to give my panel a minute to get comfortable. For those of you who I haven't met yet, I've been in the rounds, but there's a lot of us here. As Dr. Ford said, I am the Director of Operations for a Boston-based consulting firm called Engagys. Our mission is healthcare consumer engagement. We've been partnering with RISE since, I think it's 2016, bringing consumer-focused panels like this one, our annual State of Engagement survey, and engagement best practices in healthcare to their audiences. So we're honored to be here today to raise consumer voices. Our panelists today are all local to the DC area. They represent a wide range of lived experiences. They are patients, caregivers, parents, veterans, and community volunteers, among other things. I've had the opportunity to get to know these folks a little bit over the last week, and I think the biggest takeaway is, one, they are all wonderfully warm and engaging people, and two, it has never been more difficult to be a healthcare consumer. The evidence is overwhelming. We heard a lot of it yesterday, we'll hear more today, and I think we can all safely say there's no shortage of work to do, and that it demands our attention, which is why we're all here, right? So I could say more, but I think our panel will speak volumes more than any one person behind a podium ever could. So what our discussion will focus on today is three things: barriers, community, and provider and plan relationships. I'll make sure that I reserve time at the end for all of you to join the discussion as well. So I'll give you a heads up. And if people want to come up to the microphones to share thoughts, comments, ask questions, we're happy to field those toward the end of the discussion as well. So to get us started, let's give our panel a warm round of applause to welcome them here today. Thank you. All right, so why don't we start down that end, and we'll have you share your first name and share a little bit about your why for being here today.
Good morning. My name is Angie Dixon, and the why that I'm here is I'm a part-time caregiver for my aunt who has dementia, and an advocate for myself as well in my medical health.
Good morning. My name is Barbara Thompson. My mom was the first kidney transplant on the East Coast, and from a young child, I have been very active in the medical insurance.
Good morning. My name is Mary Louise, and I'm here. I was a caregiver to my mom for 10 years. She passed about 5 years ago. Medical care for her, she was in her 80s and 90s, was much more easier then than it is now. Now that I'm a senior, I'm having difficulty with Medicare, doctors dropping me 20-hour waits in the ER when you fall, fracture a limb, and getting through to the doctor. You have to pass through the nurses who really, really don't want you to speak with your doctor anymore.
Good morning. My name is Zoya. I'm here as a voice, as a single parent and a veteran. I have a child with autism, so I'm struggling right now with proper care for myself and my family.
Hi, good morning. My name is Victor Gaberman. I was the sole caregiver for my mother and somewhat from help with my father before that. And I work at a senior center. And I'm an unmarried, single person, no children, and they're often completely off the table when thought about social services in general.
Good morning, my name is Doris Tucker. I'm a lupus warrior from the mid-90s and a mother of a special needs young man. And I find it very difficult to find services for him, and I find it very difficult for me to navigate the system.
All right. So already, so much there to unpack. We don't have enough time to really get into each one of these individual stories, but I am going to try to ask some questions that get at the heart of all the things that we've been thinking about and talking about while we've been here. So why don't we start by just talking about what gets in the way of you living what you consider a full and healthy life? Any volunteers to start? Okay. Oh, yeah, there you go.
I live in a county that's probably one of the most prestigious counties around here, Prince George's County. I live nowhere that there is public transportation. I live nowhere that there is a healthy meal within a half an hour drive. And that's a big figure.
Yeah.
I live in Washington, D.C. We have had 3 hospitals to close in Washington. Therefore, the hospital wait at the average hospital, Washington Hospital Center, Howard University, is easy 24 hours. And then after you're taken to the back, you are on a gurney for another 24 hours. And then if you're lucky, you get a room. And if you're not lucky, you're sent home.
And I would like to piggyback on just what she said. In the spring, I had a fall and taken by ambulance to the hospital, where I waited 20 hours on a gurney trying to flag down any nurse or orderly that passed, because I needed to use the restroom and I couldn't move because I didn't know at the time, but I had a fractured pelvis and a fractured femur, but couldn't get help, and embarrassingly, I have to tell you, wet myself, but also couldn't get a drink of water, couldn't get a cracker for 20 hours. It was almost 24 hours. I still to this day don't understand. And then once I was diagnosed, in the hospital for a few days, sent home, still in pain. When I called about a week later about the pain in the femur, they said, well, you just have to tolerate it. If you're not happy, go to the ER. So I did go to the ER, but different hospitals, so it was a 15-hour wait, only to discover I'd been misdiagnosed and they missed a fracture in the pelvis.
Thank you for sharing. That's, anybody else? Okay, so one of the things that you've all talked about is the wait times, right? So we know that there are staffing shortages across healthcare. COVID had impacts that we're still seeing today. So when you think about preventive care, right? How's the experience with preventive care? Victor, yeah, go ahead.
I want to say one thing that worked well, which is something you probably weren't expecting. So when I was taking care of my mom, one of the things that, I live in Northern Virginia, and the healthcare providers, one of the things that was available was a gerontologist who came to the house. And that was fabulous. And she was wonderful, and could bring like mobile x-ray and all those sorts of things to the house in a way that I completely wasn't expecting. I live in an area that has we have 10 of everything. It's some of the best hospitals and doctors and everything are in a very wealthy part of the country. So it's very non-representative of what you might find elsewhere. So the point I guess I want to make is that she had a federal employee. They had a case manager who suggested this, which I wasn't aware of, and all of those sorts of things. Although the entire experience of taking care of my mom was very trying, there were certain things that clearly would benefit an awful lot of people if they were more widely available. And I would, the notion that gerontology is something that's really needed, as I am getting older and having taken care of even other older people, and I work taking care of old people. Those are something that should not only be available in wealthy parts of the country like where I live.
I mentioned the fact that I have a special needs son. He is 29 and he has Down syndrome. He has aged out because I didn't realize that I could put him on my husband's health insurance before he changed over. I didn't realize that was available to me. So now he has straight Medicaid, I'm sorry, and he needs a podiatrist. I can't find a podiatrist that takes Medicaid, which is really sad because I live 15 miles from where he lives. So there's such a disparity in such a close community.
I would like to piggyback on what she just said. My son's main doctor, for an example, as far as preventive care, he doesn't give us any resources of where to go on the outside of his care. And I have to do it on my own. And I'm seeing that you have to do your own research. You have to look at all these doctors. They're 30 minutes, 45 minutes away, which is a very big inconvenience.
So when you all think about the challenges that you're experiencing, if there was one thing that affects your health the most that you could change, what would it be?
I would like to say for myself, getting a doctor's appointment anymore. Several of my doctors have since either retired or passed away, and when you try to connect with a new doctor, like an endocrinologist, a dermatologist, orthopedic surgeon, the minimum wait is 3 months. If they're willing to take you, some offices are not taking new patients. And if you have Medicare, some offices will not take you. They don't want to do the Medicare paperwork.
Yeah, I would point out just the notion of trying to find any doctor who actually accepts your plan and will admit to it in advance, because they give you long lists of doctors and uniformly, and when I've tried to, research this or speak to people at the plan, they say, oh no, well, it's online, you can pull it up. So you pull up this long list of doctors and you check the little box that says accepting new patients, and you know in advance that that's just false. It's just false. And you have no idea. It's like playing Dr. Roulette or something. Like you might happen upon somebody who's helpful, and you actually contact them and they respond, and the person with whom you speak actually knows what they're talking about and has any idea what the limitations of your particular insurance are, and all those variables. So if I had to say one thing, it would to streamline that process so that a potential patient can find an appropriate doctor more easily.
I've got a long list of things, but I'll give you a few. I recently got a bill because I'm disabled, and my husband has a primary insurance. My Medicare is secondary. Every time I go to a doctor's office, this is my commercial primary insurance. This is my secondary insurance. I religiously, it's like a religion, I get a bill because somebody submitted incorrectly. So that means I have to go back and figure out who did what, when, and change it on both ends, and it's really frustrating. Not to mention that, sometimes they send you to these patient portals, and every doctor, every specialty has their own portal, or you're sitting online. I'm glad I don't have a job because this is a full-time job.
And Zoya, you shared the other day too that even in your experience, having a particular plan is incredibly hard to find the care that you need, not just for your children, but for yourself. Yeah. And do you go out of your way to make phone calls back and forth?
Yes,
like these folks
like
are.
she said, it is a full-time job.
Yeah.
And that's what I lack of as well, because I'm on a limited income. So I struggle just doing that and trying to make ends meet, put food on the table. Mm-hmm. And it's like roulette. You can't just find just one doctor. You got to know that doctor. You got to look at their background and see if you're going to be comfortable with that doctor.
Mm-hmm.
I have 3 grown sons. They all work in jobs where they can't make calls between 9 and 3. One works for the U.S. House Representative, one works as a teacher, and the other one is a trash man. So they can't take the time out during business hours to make phone calls. So I actually sit down on my lunch hour and my breaks, and I try to make appointments for them. And they have all different types of health insurance. So I am all over the spectrum all of the time.
My healthcare situation is that I don't feel, or I know that once I've had a doctor that started with me with my disability. That doctor retired, and I was just transferred to another. So I tried to, I've been trying to work with this particular doctor. But people have preconceived notions of you, and they don't hear you when you're, asking them and letting them know that these are the things that I need, but they already have a preconceived notion of how they think think they know that what you want or what you need. They don't listen to any of your any of thing that you're actually advocating for yourself.
So you're feeling experiences where who you are as a person is not well understood
Not at
in a
all.
variety of ways.
Yes, in several ways. I mean, just as a person or as a patient, they're not really looking at what my needs are. They're just looking at, this is a number, I can just shuffle them through, and then I can sign off and say that I've seen someone. But you actually haven't done any legwork to make or help my medical situation be what it needs to be.
Thank you.
You're saying no follow-up as well, right?
No follow-up and a lot of pushback immediately, just, oh, here they come, or they're just trying to get over, but that's definitely not the case when you have documentation in front of you saying, I'm disabled and I may need other services, but you don't even bother to try to find out how to make those services available to me either. So I feel that I'm just out here in limbo, hoping to be able to grasp onto something or someone, but I'm, doing my part in trying to make this patient-doctor relationship work. Maybe just give it a little more time, And finally, when this call came in for this panel, I was really at the limit of, I think I just need to change doctors. And boom, I was exchanging emails with the doctor, and they finally said, oh. And I could clearly understand from the email that, oh, you're an actual person. I really need to, hold up, let me go check something and then I'll come back to you. And then I've really started to actually then feel, oh, I'm not just being herded through for your numbers. I'm now going to be a person, and you're going to try to, what information you don't know, you're going to try to go and find out to help me in my daily struggles.
Yeah. And, isn't it amazing that so many consumers are doing that work and working that hard just to be seen, just to be heard at a time when they're talking to someone who's there to help them? It's hard to know what those barriers are all the time for the providers, but we do know that they're there, and that's an important factor as well. Did you want to share?
Yeah. So one of the things that I find, because I work with seniors, and I am one, and I took care of some, and one of the things that really strikes me is on a sort of community level is that just because something's available doesn't mean it's suitable. And like when we were talking before, a lot of people live far too far away from these things to even consider making use of these programs, even if they exist. And even if you get to the program, the people there, you just might not get along with them, just like I'm sure all of you have experienced, with your own medical interactions. And so sometimes the humanity of it is lost. And on a policy level, people think that they're doing something for people because it's sort of there. But whether it's suitable for the intended population is not at all clear and often not looked into very closely. So we provide this program, or this program is run by volunteers. I volunteer in a couple of different ways in my community. And in Fairfax County, Virginia, where I live, they have something called long-term care ombudsman. They are volunteers, and they're supposed to shepherd some person who's in long-term care through the maze of healthcare, and they do it out of the goodness of their heart. They're not paid a dime from the county or anybody else. And somehow this is a service the county provides, right? There's an awful lot of that where I work in social services. I'm sort of more aware of the programs that are available than most people, and yet it's often run by volunteers, and these ought not to be volunteer positions.
So this is a great segue into talking more about community in general. When you think about your communities and what's in the area, show of hands, how many of you are aware of programs that would help with some of the challenges that we've been talking about? Just Victor. So nothing local level for you guys. Okay, and then when we think about something that's maybe not working in your community, what do you think your community needs to be healthy? What would improve health?
I know this is a strange statement, but if we could go back to the doctors, like actually being in the community, my grandmother's doctor was around the corner. And that doctor was my mother's doctor and eventually became all of my aunt's doctors. So this same doctor saw generations of people, and they weren't far away. They were either, their offices were around the corner or down the street. They weren't far. You could walk to their offices.
It's been a big shift, right? You don't see that a lot anymore. Zoya?
I believe that our children's schools could be a resource, churches, especially the churches around our neighborhood. They do a lot of, giving out food, which is very scarce because they only do it like twice a month. And the wait, which is very inconvenient, you could sit in your car for 2 to 3 hours. I actually experienced one time where we waited 4 hours and the truck never came.
Now, I don't know how many of you all were raised in Washington, D.C., but when I was growing up, we received immunization at the school. They didn't leave it up to the parents. And I remember after the COVID wave that so many children couldn't start school on time because they hadn't received any of the immunizations that were necessary to start school. Well, I remember going to elementary school, and the big RV trailer came up out front, and they lined us up, and as long as you had a permission slip, that responsibility was done at the school. And to me, it solved a lot of issues. Not that parents aren't being responsible. Sometimes they work 2 and 3 jobs. Sometimes they don't have the mental capacity. Sometimes they aren't even present. And you find a lot of children who fall through the cracks because who's going to take them? I actually know a family during the COVID period. The grandmother was 82 years old. She was raising 7 grandchildren, and none of it, she couldn't teach them how to use a computer. So they went that whole COVID period without getting education.
I'd like to piggyback on her statement about immunizations in school. I'm actually from Canton, Ohio, and I also remember immunizations in elementary school where we had our permission slips signed and we all stood in line, and I cried because I'm scared of needles. And so, but that happened at school, and it was a big thing. And I also think that it would, help with the situation as it is now, where a lot of children are missing immunizations, where you might probably could catch them better at school as opposed to trying to get the parent to take off work, or if the parent is even, there mentally or otherwise, to be able to do that. That would really help.
Yeah. Go ahead.
I too was raised in the District of Columbia in the 50s, and we always, at the elementary school, twice a year, they did exams, dental exams, health exams, ear exams, eye exams, and it was so beneficial because at that time, what's now called Capitol Hill was a very low-income population, and it was very helpful to the parents. Some parents were single-family parents, some were raised by grandparents, and they just didn't have the time or the means, but the school always had a nurse on site, and then the annual exams, which was very beneficial to us children.
Transportation in general in the DMV. I live in Southern Prince George's County. There's no bus line. My son has a Metro Access card, which is a card that he can ride on the Metro system, but guess what? There's no access. I don't live close to a Metro station. I don't live close to a bus line, so he has this cute little card that he rides around. So he can't get to a doctor, can't get to a restaurant. So just the barrier of transportation. But we have churches on just about every corner. We need to look at partnering and bringing some of that stuff to the community through a natural access, which is a church.
One of the barriers in where I live is language. I don't speak Spanish, nor Korean, nor Vietnamese. Amongst those three demographics, that's about 40% of the population in Fairfax County. English is my first language. It is almost, of the people that I take care of, nearly none of them is English their first language. And it's always surprising to me on a governmental level how much faint lip service is paid to providing those services in those languages. And it needs to be very much increased.
Mm-hmm. Thank you. So when we think about kind of switching back to providers and plans, how many of you have heard from your health plan about programs that might be able to support you with a health condition, maybe something like in-home care, like Victor mentioned, help with food, help with transportation? Show of hands, has anybody heard about these programs? Barbara's a little bit, okay, all right. So if most of you haven't heard of them, of those who have heard of them, is it something that you've been able to access, or was it not really available to you after you found out more about it?
For me, I'll just do it briefly. Some of these things are supposedly, I'm locomotive. I can still drive. I live in an area where car is mostly necessary, but there are buses available. It would take hours to get most places, but you could do it if you were determined. So in terms of like mostly the transportation is one of the ones. Food assistance I'm aware of because of where I work and just in general, but also I've been contacted generally through emails and things like that about wellness programs, and I'm aware of them, but I don't think I'm the target audience for most of them. I'm still able, even though I often don't do it as well as I ought to, can take care of myself. So I'm aware of them. I don't make use of them. The people who most need to probably make use of them probably are not nearly as aware of them.
Yeah.
I know that the healthcare people send the flyers and things, but everything is assumed that everybody has a computer and everybody has the internet. And then when you go on the sites, it's most of the time it's not friendly. And so if I'm assisting an uncle or a cousin or things like that, I am trying to figure it out even for someone else. So I see a touch of reaching out for services, but often they are really difficult to maneuver.
Okay, so when we think about establishing trust with a provider or even with your health plan, what kinds of things help with that? What makes you feel seen? What makes you feel heard? What makes you feel like you're not just a number, like you mentioned earlier?
I think the difficulty that I have with the health plan, and especially Medicare, is they give you a toll-free number to call 24/7, but you cannot get through. It's always busy. Even if you try 2 in the morning, there's no answer, but can't get a response, which also brings up to me the issue of this portals. The doctor's offices want you to use their portal, but when you put, if you can figure out how to get into the portal, and then you need another password on top of your bank password and your password for other issues that you have with other doctors. If you get in there and you leave a note, you may not get a response. And then if you call the doctor's office, it's always leave a message and we'll call you back within 24 hours. Well, I called my endocrinologist last week because I'm still not feeling well, and have yet to get a call back just to get a simple blood test.
Positive for me is basically being able to contact the insurance when I want, either via phone or email, which is a good thing. And also recertifying for your every yearly. You can do it online with ease. Doing by the mail, you have to print documents and things like that. So I think there's a positive on that
That's great.
end.
When you have complex care, it's really hard to coordinate. You have to have a general, and everybody wants to be in charge. However, nobody's in charge and nobody's talking to each other. So the nephrologist is not talking to the rheumatologist is not talking to the general. And if you're not advocating for yourself, you're in trouble. And if you don't know to advocate for yourself and oh, yes, Mr. Doctor, okay, you're in trouble. And everybody doesn't have that ability. I've been in the system long enough that I've learned, no, I don't think we're gonna do this. Let's talk about some alternatives. But everybody doesn't have that resilience. Everybody hadn't had that frustration, and everybody hadn't gotten to that place in their healthcare that they're saying, oh, I'm sick of this. I'm gonna help take charge of it. And I feel bad for those people because they are really getting screwed over.
Oh, just to do briefly, coordination of care, always. The portal business is like, they don't talk to each other, they can't send records to one another, they claim to have received your records, but it's not really clear, or they generally haven't received it, and they say, go please check, tell them to send it, whatever. So long story short, I mercifully am not, don't have any chronic conditions and haven't had to make use of specialists in that sort of way much. I use, and it's all coordinated. The downside for most people is that you have to do everything through them, but for someone like me, it works remarkably well because all of their different branches and specialties all look at the same record. Why that isn't done universally is confusing to me because obviously it would benefit everyone.
Mm-hmm. So I'm going to invite the audience to come up to the microphones. If you guys have questions, thoughts to share, please feel free. I see Dr. Ford leading the pack. And while everyone's gathering at the microphones, I just wanted to highlight one thing that came up in our conversations as we were kind of getting to know each other last week too, is that food insecurity is something that we talk a lot about in rooms like this. And though all of you have access to food, you all highlighted it's not easy to get to, it's not great. So there's this concept of food deserts and food swamps where there's stuff near you, but it's convenience stores and the options aren't great. So if anybody wants to share any final thoughts around that, because I know we didn't really touch on that yet.
I will. There are 2 grocery stores near me. However, they are notoriously dangerous because you are targeted immediately upon driving up on the parking lot. And so you can't go somewhere where you don't feel safe. You can't concentrate on what you're trying to pick up in the grocery store if you're always, on the lookout as somebody, on the take for me. So therefore, that to me also constitutes making it a food desert where you have to go to another area where you always be aware of your surroundings, no matter where you are, but you don't have to just always be on guard immediately, as opposed to the stores that are closer to me.
Thank you.
And to piggyback on what she just said, I live within 3 blocks of a grocery store here in the district, but I cannot go there. It's way too dangerous. There, people are allowed to loiter outside the door begging for money, and if you don't offer up something, you're harassed. And then when you go in the store, even though there's a security person at the door who's most of the time on their cell phone, people are shoplifting. They're looking at you, seeing how they can get your purse, seeing if you're going to leave it in the cart. So I don't go to that store near me. I drive about 2 miles to another store where it's a bit safer. But during my injury this spring, I had difficulty. I didn't have anyone to care for me at the time, and I had to call friends in Maryland who came in to bring food when they were off work or on the weekend.
Thank you.
Just
Zoya,
one
did you
word.
want to share? Oh,
Real
sorry.
quick. There are poor people in rich areas. I live in one of the, I think it might be I think second or third wealthiest county in the United States. The greater Washington area is known to be the wealthiest metro area and most highly educated and lots of other things like that. But there are lots of poor people here. I'm one of them. That gets lost a lot too. It's more socioeconomic than demographic sometimes.
Zoya?
I have, like I said, I have very limited income, and every time I work, sometimes I'll get food stamps, and then they cut me right off. So just going to the supermarket, you have like 3 bags of groceries, $60. I don't even have no meat. So end up going to places like Aldi's where you get low quality food just to make ends meet, which is not cool.
No.
That's why I rely on the food pantries, which they don't give much at all as well.
Thank you. Dr. Ford?
Wow. And I'm sure that's that's probably the only single word I could say that's not a curse word. So thank you, first of all, for sharing your experiences. Storytelling will always win over data every time. Fellow lupus warrior, and I there was so much I could relate to. I don't tell people I'm a physician when I try to make an appointment just to see whether I will still be treated with respect. And I think that I should not have to share a degree to just get service. So I'm listening with my heart and I'm listening with my head. And so the themes that I'm hearing, number one, access, which is always going to be an issue, cultural competency and empathy, and health literacy. Now, it's really hard to grow doctors. That takes a really long time. So access is going to continue to be a problem in this nation. But, and it's also a challenge to teach doctors how to behave appropriately sometimes because, that's, and I'm saying that as a doc. But I do feel like maybe with, because there are programs that will at least have community health workers and patient navigators, because I feel like what you need is that middle level of linkage. And so I'm just trying to get a sense from you all, because I'm trying to solve a problem here. I'm hearing you, but I'm also trying to fix this. So do you think that if you had a person that was a more direct connection to you and whoever was trying to pull all these things together, if that would be a helpful thing?
Sorry. I think that would help with some of the continuity of care because everything is so disjointed and broken. If I had one person that I could call and say, hey, this is what's going on, can I reach out to this person, or does this person have my new records, or this, I'm going to a new doctor, can you help me get those records there? A lot of that will save a lot of time. Or a podiatrist, do you know that podiatrist will take this insurance? Even simple things like that. It's easy for me to navigate because I'm younger, But as I age, it's getting harder. I mean, I'm only 60, but I've been doing this for a while, so I've gotten it down. I can't imagine trying to enter in at 70 or 80 and trying to do this process. So a patient navigator would be excellent. Now, what would that patient navigator look like?
One thing at a time.
So in answer to your question, obviously that would be hugely beneficial. However, to the extent that such things are available, they're also often the person who is most overburdened. And that person is only helpful to me to the extent that they're helpful to themselves. If they don't have the opportunity to be familiar with my case sufficiently to help me, not out of any fault of theirs, but because they have too many other things going on, it's really, again, one of those things that's available but not suitable.
10 years ago, excuse me, 10 years ago when I was my mother's caretaker, I was not a senior. And I was able to do for her exactly what you're describing. Everything just fell into place. It was easy for me to get care for her. But of course, she's now deceased. And now that I'm a senior, I'm not able to do for myself what I was able to do for her because of lack of response from doctors' offices, lack of doctors taking Medicare, and also just doctors not available.
I spoke yesterday, and I agree with everything that each one of you are saying, because nobody seems to be listening because of the way it's organized, the way they're stressed out, and it needs to change. There is absolutely no excuse for the richness of this country and the way we as a population are being treated, because I've been in doctors. I started out with heart attack. I had some stents put in, I was fine. But the process I went through, the first cardiologist I saw, I could tell he didn't like patients. And so I told him that I'm not an advocate for pharmaceuticals. I wanted to test him. I wanted to see where he was. And before I left to go to Burlington at the UVM where they would put in stents, he pointed his finger at me and says, "It's your genetics. It's your fault. It's your fault. It's your fault. It's your fault." And then after having the stents put in, when they gave me the pharmaceuticals, they just sort of scammed and told you about it. I had never taken a pharmaceutical in my whole life, except for once when I threw it out. Well, in that experience, I thought I was gonna die because of the way that it changes your lifestyle. I can understand why people have mental illness on them. I've seen people they turn into mean, physically abusive people. So there's a lot of things that are wrong. It's a whole combination, and it's got to change. But I'm speaking from my heart anymore. I can be angry, but I can't change it through anger, because that's actually the way the systems are built. The system is a fear-based system. Our whole reality seems to be a fear-based resistance. And so the only way that I navigate anymore is take my time, internalize it, and I have to give myself forgiveness first, and I go from there.
Good morning. Thank you all for being here and for sharing your stories. Everything that you folks said has really struck a chord with me, and you, sir, have amazing sound bites. I've been quoting you in my notes. And something that you said was the humanity of it all, and I'm going to kind of extrapolate here. The humanity of it all has been lost in the adherence to regulation and policy. I really think that's what it is. And you, ma'am, what you said is, they don't see me as a person. They see me as a number. I feel that when I go to the doctor, urgent care, anything. They're not looking at me. They're looking at what they need to check off on their boxes. And that can sometimes be detrimental to the point of, mortality even. I'll share with you my story with my newborn. I had a newborn daughter, and she was very sleepy, couldn't wake her up. Took her in day after day, and people kept dismissing me, saying, "It's a newborn. What do you think? She's gonna sleep." But I advocated for myself because I know how to do that. And I shared with them some of my prenatal care, and they said, "Oh, wait, something else is going on. Why don't you take her down to the ED and find out? She was having seizures every 15 minutes, and they had to admit her for the next several months. And, you know, I mean, it was like she would have died if I had waited another few days. But you advocate for yourself. And I really hope that you all continue to do that. And I really hope that through this social determinants, you know, this asking of the questions, kind of those personal invasive questions. Do you have trouble with transportation? Do you have trouble with safety, right? I'm hoping that patients are able to share that and really break through that barrier and have that doctor look up and see you as a person. So good luck to you. I hope that your provider really takes care of you like you should be taken care of. So thank you all.
much.
God bless you.
Thank you for sharing your story as well.
Can I just say one thing? I just want to use the restaurant Chick-fil-A. I don't think that anybody has ever had a bad experience at Chick-fil-A. I don't know what they do about customer service, but everybody knows, from the gentleman sweeping outside to the manager. And if we could just take that concept and put it into healthcare, that would be awesome.
Yes. There you go.
Hi. First off, thank you. Your stories and what you have shared is meaningful and impactful. I have a question. So I work in an area, like many of us do, where when we look at addressing these problems and we look at how can we find solutions, there's a strong priority on having folks like you at the table, right? Having people navigate this at the table. Also strongly believe that when we ask people to come to the table, particularly when it's not related to our paid work, right? When I'm at the table, it's part of my job, I'm paid to be there. How we can make it have more value to you than it is that we're asking of you to come to the table. So first off, that starts with paying, right? If I'm paid to be there, everybody should be paid to be there. But also you should, as a person, what are the things, and I know that this is like a ridiculously tough question, but what are the things that, if you're in a meeting or you're in a committee or you're sitting on an advisory panel to try to tackle these problems, is there anything that comes to mind, outside of obviously everybody should be paid to be there, but that would really make that meaningful for you?
The follow-up, knowing that what I input has either been implemented or made some change, but sometimes you be on these panels, you talk to people, and you never know that you made an impact. It's like I'm talking to the room or the wind, and I'm like, oh, well, the wind didn't say anything back to me.
Before we came out here, I asked, somehow the subject came up in the way, and I said, well, everybody when they're in this room will you're mostly preaching to the converted amongst yourselves. So, and when you leave, you go back to your own jobs, and everything's just as crappy as it ever was. So, so my answer to your question is, I agree. The feedback, it needs to be more than just a one-way conversation.
Thank you, everyone. Thank you. Yeah, this was fantastic. We're out of time, but I just want to give a warm round of applause for our panelists today. Yes. Thank you all. Thank you so much. Thank you all for being with us today, for sharing your stories. Those lived experiences translate to so much more action. So I'm thrilled to have been up here with you all. And that's a wrap.